So greeting friends and followers. This is Nurses Talking. I am Jill Barzy. As always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today, joining me is MaryEllen Laureano. MaryEllen is a nurse practitioner. She's a health content writer. She has 20 plus years of experience in public health. She specializes in STD, HIV care with a focus on adolescents and high-risk Latino population. And she has extensive experience in women's health, labor and delivery, HIV, STDs, and teens. So MaryEllen, thank you very much for joining me today.
Thank you for having me.
Yes. In all of this thing, I looked at your bio and I thought, yes, I love this. I love this. Just particularly because you focus so much on the younger population. So not just, pediatrics, but teens.
Yeah.
I love this. I love this. So start with me. Tell me, why are you a nurse though?
But why I became a nurse initially,
Yeah.
it was kind of by accident. Initially I was going to college as a young mom and wasn't really sure what I was going to do with my life, just taking some college courses and just kind of muddling along. And then I ended up in a biology course and met some other nursing students and kind of clicked with them. And they were a little bit older than me. And I just started thinking about, like, wow, I've always been a caretaker, nurturer kind of person. Like I said, wasn't really sure what to do with it. And then all of a
Yeah.
sudden, this nursing thing clicked, and I was like, yes, this might be it. And so it just started from there. And I think I was 21 years old, had a 2-year-old at the time, and didn't work. My husband worked, and just was trying to grow up at 21.
Yeah.
So I went to a really neat community college that allowed me to bring my daughter on campus. So that's how it all started. And right after figuring out that this might be what I want to do, I took a CNA course and started working as a CNA in addition to going to school, and did that the whole time through school and everything. And
Yeah.
that's
Yeah.
how it started.
It's, as I listen to stories of how people became nurses and stuff like that, so often I get the feeling that it's like, it pulls you in from so many
Yeah.
different areas. Some people who never actually even thought about it or thought that's wanted to do and somehow bumped into it. And then it was like, it's no letting go.
Right. Yeah, that's exactly what happened.
So you started though as a CNA, which kind of gave you a glimpse into what it would be like
Mhm.
to be a nurse. But still, when you got there, was it what you thought?
Um, Not initially. I started actually in an Alzheimer's unit, and of course I was young, and so it was all new
Mm,
to me, and so that was my first experience with it. And so I was like, I don't know if I can do this all the time. But as I got a little bit more into it, and when the I guess frightenedness went away, I thought, no, this is really neat. I can take care of people. And then, of course, through my nursing schooling, I had a couple different CNA jobs in addition to the clinicals with nursing. You see all different parts of nursing.
yeah,
There's geriatric, there's labor and delivery, there's
yeah,
operating room, there's this and that. And so um, I ended up, one of my nursing instructors said that there was a position in labor and delivery as a surgical tech, and that they train on site. And so she kind of got me that job, and I love that. It was a great training experience. And I ended up doing that for probably a year through the nursing program. And so I did do, a CNA in a nursing home. I did it in mentally disabled sort of situation. But I just felt like it was a necessary thing to do, while I was in nursing school. And so I just got experience from all different angles, I feel.
Yeah. And that's great because what that tells me though is that once you did become a nurse, that anxiety and apprehension for you was probably much less than it would have been for someone who took another path.
Right. And even when I did actually become an RN, I was, the anxiety was high. And I remember
Mhm.
having other students that I knew in the class that didn't do anything during nursing school in the medical field. And I thought, oh my goodness, how are they?
How are they managing? Yes.
Yeah, because I knew how I was feeling. So,
Yeah. And that anxiety is so real. It's so real.
mhm, yeah, I
So,
don't
but
think,
mhm,
I don't think I, it was sort of a joke when I worked on med surge and I was the new nurse and the younger nurse and the other more seasoned nurses. I worked night shift. They were having a break and coffee at 2 a.m. and I was like, I haven't
no.
even been to the bathroom yet. So it was sort of a running joke that I was there for like 6 months before I actually was able to sit down and have a break with them during
Yeah.
the night.
Yeah. I get that. I get that. But you worked so many different areas. You talk about, Alzheimer's, labor and delivery, or surgical tech, you've done CNA and all of that. What led you to focus on teens?
So I loved my labor and delivery experience. And of course, that's young females and up. I went back to school to be a nurse practitioner and decided to do the women's health program. And it was a program that was sponsored through Planned Parenthood. And
Yeah.
so, of course, that is mostly a teen population. And in lieu of them sponsoring me through the NP program, I worked for them for 3 years
Okay.
post NP school. And so I love Planned Parenthood, and that's mostly where teens are. And so I had the opportunity to actually start a teen program at one of the local Planned Parenthoods, and then I also did a Latino program as well. So it's a nice group to work with, lots of education, and now I have two teens myself,
Hmm.
girls. um, but I just love the educational piece, I guess.
Yeah. And I guess you kind of answered the question that was leading me to, because I was going to ask you what is your biggest challenge? And I guess your biggest reward of dealing with that population. And I guess, education is probably it.
Yeah. And even now, being in public health, the clinic I work in is STD HIV. But there's a large teen adolescent population within that group. But it is a broad range.
Hmm.
But I like working with that group because they tend to listen to me in the clinic. And I feel like sometimes I get to them where, and I can give them information. I just like the one-on-one because
Yeah.
they're craving information. And when I close my exam room door, I sort of feel like Dear Abby sometimes. Um, so I like to be able to help and educate and give them proper information.
Yeah. I, and you said that they're craving information, you
Uh-huh.
know, um, and that's a huge thing. When you said that, it kind of resonated for me because, many times we tend to think of teens and young adults as people who just doesn't know it all. But in fact, that's not the case.
Yeah. And I
Yeah.
have, like I mentioned, I have two teen daughters and then I have a much older daughter.
Hmm.
But when she was a teen, she had volunteered me to do an elective class in her high school. And I was working at Planned Parenthood at the time. And I was thinking, gosh, I have 45 minutes to talk to these teens. I have all this information I wrote down because I thought it's going to be boring. And all I did was open my mouth and say who I was and where I worked. And I didn't even need to do any of what I had written down because the hands were flying and, the teacher invited me back and, it was just like, oh, well, okay. We're already done. It's 45 minutes and they wanted me to stay longer because, they just are really interested in knowing.
Yeah, yeah, yeah. So, what would you say though is the biggest thing you learned from them?
I guess the biggest thing I learned from them is that they want to know and don't want to ask. Um, I have one that wants to know everything and details about everything, and my other one doesn't want to talk about anything. So they're all different in that respect. And
Yeah,
even though they might not act like they want to know or are listening, they are.
they are listening. They are listening. And
Yeah.
listening, yes, indeed they are. Sometimes I wonder if they even know they're listening, but they're listening.
Yeah. And they're listening, but they don't obviously always apply what
Yeah,
they're listening to because of my current position. The frustrating thing about it is um, the repeat clients that we see. And, so getting through to them is difficult, but you just got to keep trying.
yeah, yeah, yeah. Do you get a lot of repeats?
We do. Yeah.
Ah,
And I've been in this particular clinic for 21 years. So I have seen some patients that I saw when they were young teens,
yeah,
that are
yeah,
now, adults.
yeah, yeah.
Um, or even unfortunately, sometimes, siblings or children of some of the people that I
Awesome.
saw
Yeah,
many years ago. And
yeah,
so it's good and bad. They remember me, and sometimes they feel comfortable coming back to me. Um, but, it is unfortunate.
yeah, yeah. I get it. I get it. But then I guess we get to the place where we know that as nurses um we really cannot have the same impact on everyone. We really cannot
Hmm.
heal everyone. You can't. So sometimes, those ones who come back, they come
Hmm.
back. At least they
Yeah.
did come back.
Yeah. Yeah. They do come back, I guess, which is good because they're comfortable coming back.
Yeah. Yeah, exactly. In that. So having worked though, if we go back to like the hospital a little bit, and well, you're still working in institution area. Is there anything that you think you would like to see change about the structure or how nurses are trained or anything? What would you like to see change?
Um, well, being out of the hospital setting for so long, I have some family members who are newer nurses and, a couple
Hmm.
are still in the hospitals. And so I hear, what they talk about and things like that. And my mom was a frequent hospital patient. She passed away from heart disease, but while she was alive, there was a lot of admissions and
Yeah,
stuff like that. And that was only a few years ago. And so what I noticed, like when she was a patient, just what you hear all over, um, overworked, stressed out, um, afraid for her to be there alone without
mhm,
somebody overseeing her care, finding mistakes, some serious mistakes that could have ended things differently if I hadn't picked up on them. And not blaming nurses. I mean, it's sort of a domino effect. It's,
yeah,
the institution, it's the insurance companies, it's the doctors, it's, you know, um, so not just in nursing, but just doctors, maybe not listening to nurses because they're so busy. We're the eyes and ears of the information. And just an example of what happened with my mom, INOs in the hospital is like a gold standard for
yeah,
a lot of information. And they were not being done right. And so as a CHF patient, that's really important. And
yeah,
so weights were done mistakenly. And so her physician was going on the data that he was given. And so it just really opened my eyes to, like, going back to when I was a nurse, nothing has changed. I felt the same things when I was a nurse in med surg. I mean, I was a brand new nurse on night shift having 12 patients.
Yeah.
And it's still the same.
It's still the same.
Yeah. So and staffing and that sort of thing, just support, because we're losing nurses left and right in the field.
Yeah. 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 And that it's sad that that is happening.
Mhm.
Because many people had a vision of what they wanted to be, had a vision of seeing them, they saw themselves taking care of others. And no matter where you are as a nurse, you are a nurse, you're taking care of other people. But that's not the vision they had. And then they have left it because they're frustrated, because, things are not falling into place, because it perceive that no one is listening, all of that kind of thing. And as you say, so many years later, nothing much has changed from our perspective. And I
Yeah.
asked the question of what we would like to see change because I really want us to think about what we want to see change and articulate it. And somehow, maybe if we all keep putting it out there,
Mhm.
maybe somehow some kind of change will be effected slowly, maybe. I don't know.
Yeah.
Um, but I hear this complaint and this frustration all the time.
Yeah.
Um,
And
and
even
mhm.
in the outpatient clinic, I work in public health. When I first started there, it was I don't know how to say, your typical STD screening patient, I don't want to say simple, but less complicated. And now even our STD patients in an outpatient clinic are becoming, much more complicated, more acutely ill
Yeah.
and different, and
Hmm.
ending up on
Hmm.
our doorstep because
Hmm.
they don't have anywhere else to go.
Yeah. 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 What would you think? How would you like to see? So going off from that, from what we see and how nurses are, what do you think you'd like to see um as a nursing setup, or how nurses are viewed or treated or accepted in like the next 10 years or so?
Um, just definitely more supported, especially in the hospital setting, the bedside setting, um, doing something so there's less burnout and more training, like in new nurses and stuff like that, because it'll start in the beginning. And not even nurses, even clinical support,
Mhm.
nursing assistants.
Yeah. Yeah.
Um, because there's just so many steps involved in patient care, and nurses are sort of like in the top tier, but there's lots of people under us as well. So recognition on how important we are to the doctor. The doctor is for the most part looking at data collected by the nursing
Right.
team,
Mm-hmm.
and the nursing team is collecting data from the CNAs. And so just respect, support, um, increased training, and just understanding how difficult of a job it is. And like I said, more importantly in the hospital setting, all
Yeah.
settings, but
Yeah.
that's where we're going to be falling short for sure in the
Yeah.
next 10 years.
Yeah.
Um, when I went to nursing school, and even my older daughter, who's also a nurse, um, she's just been a nurse since 2015. But, to get into nursing school, it was very difficult. They were doing a lottery situation because, and I'm not sure now, but I don't even think there's probably a wait list anymore to get into the programs.
Mm-hmm.
Um,
Mm-hmm.
and even when I went to school, you had to do all of your prerequisites and then, apply to the nursing program, because there were so many applicants, and I'm not
Yeah,
sure that that's the case. So I don't know what things are going to look like in the next 10 years. And then, of
yeah.
course, COVID on top of that. Um,
Yeah, yeah,
I
yeah,
think that we're going to see that trickle down effect, in the next 5 years for sure, or less.
or less, or less, less. I am truly hoping that as nurses reach for other things. I speak to a lot of nurses who are becoming entrepreneurs and business people and starting their own nurse practitioners who are starting their own practice and stuff like that. I am kind of hoping that that would help to garner some kind of respect,
Mhm.
get us into some C-suites where decisions are made, that somehow those things can, take hold and maybe trickle down a little bit to make some kind of change.
Mhm.
Yeah.
Yeah, and that's sort of where I'm at in my career.
Mhm.
I actually retired from my public health staff position January 1st,
Mhm.
and I'm still there contract. So I joke because I say I'm still trying to figure out what I want to be when I grow up. But that's sort of where I'm at, trying to figure out what I want to do next,
Yeah.
where
Yeah.
I'm going next.
Yeah. And actually that's quite the beauty of nursing though. You can do that. You
Hmm.
can take the time because there will always be something to keep you afloat. And so
Right.
you can take the time to figure out what you want to do and find your niche.
Right. And then that's kind of how I feel like I could get a job today if I wanted to, full
Mhm.
time.
Yeah.
Um, but I'm being a little picky. I've been a nurse a while, so and a nurse practitioner a while. So I'm just kind of feeling like when something comes into my lap, I'm gonna know
And you will know. You'll know
that's
exactly
what
what
I'm
that
supposed to
is.
do.
Yeah. What advice? So you're a nurse.
Mhm.
Um, your daughter is a nurse. What advice would you give to someone? What advice did you give her?
So even though she's only been a nurse since 2015, and going back a little further, she initially wanted to be a nurse right out of high school. Didn't, just sort of flopped around, started nursing school sort of, but thought, no, I don't want to do that. And then she worked at a hair salon, actually went to hair school, did
Uh-huh.
hair for 2 years, and then at 23 went back to nursing school. Um, so what I told her was that there's always going to be a need, and I just spoke to one of my younger daughter's friends. She was over the other day and she was asking me advice about being a PA versus an NP and what I thought, because she wants to be a nurse. And I said, the thing is, you need to get through nursing school and do all the parts of nursing school. But when you get out, there's so many different parts of nursing you can do. You don't have to do bedside. You don't have to be in the blood and guts. Like some people are like, I want to be a nurse, but I don't like blood and guts.
Yeah.
There's research, there's teaching, there's just so many parts of it and so necessary in different fields. I mean, forensics, I could go on and on and on.
Yeah. Yeah.
Um, so, just encouraging them. It's not, when you think about nursing, it's just not one thing. There's so many parts of it and so many different ways you can help. And so I never tell people anything negative about it, honestly.
Yeah.
I said, you know, I explained like I loved labor and delivery. I have a best friend who's a nurse, hates labor and delivery.
Yeah.
She loved the respiratory care unit. And I thought, I can't do spit. So
Yeah.
and it weeds out some people, the nursing school definitely does.
Yeah. And it
But
should.
you need to I always tell people it's a great profession. You could write, you can do so many different things.
There's no limit. Anything, any area of life that you can think about, you can work in as a nurse. Anything.
Mhm.
I can't think of one thing. I haven't yet been able to think of one area where a nurse could not work.
Right. And
Yeah.
even though I'm a seasoned nurse and now I'm in the job market, so to speak, and on job boards and stuff, and I myself am finding out new things and I'm like, oh, well, I could do that. Well, I could do this.
Yeah.
And I haven't, you know, done a resume for myself in 20 something years. So that's all kind of new to me. So it's kind of neat to relearn some of that stuff too.
Yeah. And that's really one of the goals of this channel. You know, I really want nurses to see nurses doing other things and figure, oh, wait a minute, you know, nurses do that? Yeah, we can do that. Yeah, we
Yeah.
can do that. Yeah, you can do that. If you're feeling stuck where you are, you don't have to be stuck. Just go look at what this nurse is doing.
Hmm.
Yeah. So you talked a little bit though, you mentioned a little bit about people being so burnt out. And it's a word that we're hearing all the time, every single time I speak. And so I have wondered, what can we do about the burnout? Because, you know, um, we're hearing a lot about it now, particularly since the COVID pandemic, but it's not new.
Hmm.
It's not new.
Right.
It was happening. People were burning out. We weren't talking about it that much. And so I'm saying, is it happening because um we're not educating people well enough? We're not educating people to expect how much this will take out of them, or to recognize the signs, or you know, is it just the outside forces like the short of staff, the lack of respect, that kind of thing that's causing it? What do you think?
Well, um, when I was in the hospital and labor and delivery, and I was there for quite a while, and I decided to go back to NP school, it was really because I was tired of working hospital hours. I was tired of working holidays and nights and weekends. And but it fit me for a long time. Yeah, I did it for, 7 years. But I think as we evolve in our lives and what's going on in our home life and everything else, like I said, at the time, nights were really good for my daughter, and that managed well. And my daughter now, her husband works Monday through Friday. She works every other weekend. So there's no childcare and everything. But I'm sure as her boys get older and go to school, she'll want something different. So I think sometimes it's not just burnout. I think it's, just changing lives and schedules and that sort of thing. Um, but I also think if we recognize the burnout, or just maybe the area they're working in, maybe there being some transitioning to other
Mm-hmm.
units,
Mm-hmm.
trading off,
Yeah.
maybe not doing the same thing every day, all day, every night. And, maybe even trading off in administrative duties, maybe your bedside 2 times a week and administrative 1 time a week, and you're trading off with somebody else. So I definitely think that changing up some things for nurses, and recognizing the burnout
Yeah.
as when it's real burnout, and just I just want to change, maybe cross training and that kind of thing,
Yeah.
and
Yeah.
maybe giving them the opportunity of within that hospital, maybe some sort of pooling where, you're okay. Is anybody interested in changing what they're doing right now? And
Yeah.
then giving them the opportunity every so often to do that.
Yeah. 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 All of those are good places to start, I think, because um, you know, it be so many good and genuine people are feeling a little bit lost and overwhelmed
Yeah.
this time.
And then there's those positions that are sort of like sought after positions, and you're just like sort of buying your time on this floor because you're trying to get to this floor.
Yes.
Which that's just, I guess, the nature of the beast. You have to do your time, you have to do your
Yeah.
nights. And, when I was that tech in labor and delivery, I thought for sure when I'm done with nursing school, I'm just going to be an L&D nurse. And my manager was like, oh no, absolutely not. You go do a year of med surge and then you can come back and ask me for a job. Which was really, I was devastated at the time because it didn't occur to me she wasn't going to hire me as a nurse.
Yeah.
But it was really good experience now that I'm looking back on it. And, I'm glad that I did that. I went back to her like a year to the week. And I told her I did it. And she, there was a position, so I came back. But yeah, so just, I don't know. I don't know what the answer is, but I think it's a great profession. It's
It is.
rewarding. It's ever changing. I don't know what it'll look like for new nurses, but I would hope that, speaking out more about it is going to change something.
Yeah. 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 We do have to speak about it. We do have to stand and say what we expect, what we deserve, what we demand, who we are, you
Right.
know. Um, and we can't continue to because in my view, a lot of this is that we have let other people make decisions for us.
Mm-hmm.
And I think it's time we stop that.
Yeah.
Yeah, I think it's time we stop that. What does self-care mean to you, though? We talk about that a lot too. What does that mean to you?
Yeah. So I'm really trying to get a better handle on that for myself. And I had all these big plans of self-care, what it was going to look like after January 1st. But I think we as women and nurses,
Mhm.
moms, wives, everything else, put everybody else ahead of ourselves. So what it looks like in my head never looks like what it does in practice. But what it should look like is taking care of yourself before you take care of other people.
Yeah, yeah,
Um, so it's definitely a work in progress and something you really have to put forth. And so, like I said, for myself, really trying to work on that, but just relaxing, doing healthier things for yourself, getting your nails done, going shopping, um, put it, sitting down and
yeah,
and
yeah,
just, you can get to the other stuff tomorrow sometimes.
yeah, yeah, yeah. Um, you mentioned you talked about, women nurses, all of that, and we tend to it's intrinsic. I think we just naturally tend to put everybody else ahead of ourselves. And when we talk about self-care sometimes, when I talk to people about self-care, and I think that we really have to recognize what exactly it means to us individually. Because of course it doesn't mean the same thing to every person. Um,
Hmm.
but having recognized it, that we need to be consistent about doing something about it, practicing. And it doesn't have to be big.
Right. Yeah, that is true. Because sometimes self-care is having my house clean.
Yeah. Yes, indeed. Yes, indeed. Sometimes it's just that, or, not even as big as that. But yeah, so it doesn't have to be big. It just has to make you feel that you paid attention to you.
Hmm. Yeah.
Before we go, is there any gem you'd like to leave us with?
Just just do it. Don't be afraid. Go into nursing. It's very rewarding. It's everything. It's frustrating, but it's
Yeah.
it's lucrative. It's job security. It's feeling good about taking care of other people. I love public health. I love serving the underserved. It's just a rewarding career.
Yeah, yeah, yeah. And I'm glad you started that whole thing by saying it's everything.
Yeah, it's
Because
hard
it
to
is
pinpoint.
everything.
and I feel very fortunate in my career so far.
Yeah,
And
yeah.
I feel fortunate in the fact that I'm pretty young for retiring from that position, but now I can decide if there's something else I want to do. And there is, I just haven't found it quite yet.
Well, I just realized that we talked about a whole lot of what you did, but we didn't touch on your writing.
Yes. So that is a passion of mine. And that was what I was going to do as soon as I retired.
Mhm.
But lots of other things got in the way. And now I'm thinking, I'm not quite sure that that's exactly what I want to do. So I have done some of it, but I
Mhm.
haven't put it on the front burner, so to speak. Um, because I'm thinking there might be other stuff I want to do as well. So I don't know. I'm not sure where the writing is going to take me. Um,
Well, if there's one thing I have learned is that things, as long as you continue to explore, things fall into place. And suddenly you know that what it is you wanted. Um,
right, right.
as long as you continue to look, it'll show up.
Yeah, and I feel like I'm just sort of like in this, I'm networking with everybody. And then
Hmm.
I'm realizing in my career, I just know a lot of people in all areas. And so
Yeah,
um, and then just being on LinkedIn, I've gotten tons of,
yeah.
connections and things. And so I guess that's kind of what's making me doubt a little bit. Maybe I'm just not going to do the writing. Maybe I'm going to do this, or maybe I'm going to do
Hmm.
that. And so still a work in progress, trying to figure it out.
It'll happen. It'll
Mhm.
happen.
Right.
Mary Ellen, thank you so very much for doing this. I truly appreciate it.
Well, thank you. It's been fun and I enjoyed it.
So did I. So did I. It's been my pleasure. Thank you.